to address the valedictory session of the 12th International Health Dialogue. Some of you would be wondering why the External Affairs Minister is doing so. And the answer is that we in India envisage health as central to development and development as key to international cooperation. In recent years, many of our global initiatives have revolved around health security. This is a domain where India has been the first responder, a development partner, a supply chain link, a health solution provider, a knowledge center, and in many ways, especially in the last decade, an exemplar. Allow me to dilate on these different dimensions. When the COVID pandemic started engulfing the world, the initial deliberations, and I was myself present at some of them, envisaged India as potentially the biggest concern. Ironically, India ended up not only looking after its own needs, but actually stepped forward to contribute to the world. We provided medicines at that time to 150 nations, vaccines to 99 countries and 2 international organizations, as well as masks, PPE kits, gloves, ventilators, you name it. Equally important, India chose to do this when its own vaccination program was still unfolding. A large number of developing nations received Made in India vaccine, either through our Vaccine Maitri initiative or other global programs. Now, this was in contrast to many developed countries who had stockpiled vaccines to the multiples of their population. Indian medical teams also went out in the Indian Ocean region, deal with pressing situations in some smaller countries. But this was not just an exception made during the COVID era. In fact, it is part of our approach to the world, both before and after. Recently, we dispatched 66.5 tons of medical supplies to deal with the humanitarian crisis in Gaza. A little before that, a consignment of 1,400 kilograms of anti-cancer medicines were sent to strengthen the medical capabilities of hospitals in Syria. Even in Afghanistan, India has stepped forward with 300 tons of medicines in the last few years, as well as the dispatch of specialists to a hospital that we had built in Kabul. Now, I can give you numerous other examples, whether it was to Sri Lankan hospitals during the economic crisis in 2022, to Ukraine as the casualties in the conflict spiked, or to Myanmar when it was struck by Typhoon Yagi. And the contributions themselves, they could be Bhabha cyclotrons to treat cancer, as in Mongolia, Kyrgyzstan, and Kenya, or the Bhishma cubes for first line of care which we gave to Ukraine, or for that matter, APIs and antibiotics which we supplied to Cuba, or the medvac services and sea ambulances ministered in the Maldives, or even the Jaipur foot in Cambodia, or the dialysis machines in the Pacific Islands. In this pursuit, Indian diplomacy has worked with partners, big and small, islands and landlocked, close and distant, but united in their desire to ensure a better life for their citizens. Friends, India today has delivered more than 600 significant development projects in 78 nations across the world. Now, many of them are in the health sector. In parallel, the private health industry of India has also contributed to facilities and capacities in different geographies And I want to say today that we value this industry as a partner. From specialty hospitals to primary health centers, we have sought to make a difference across a wide spectrum. The COVID experience was a reminder to many nations